Okay, so I'm going to pick up some points which caution against the use of online counseling, and here the focus is going to be mostly on the video call, because I think that is probably the closest we can get to real-time situation. Now, are we looking at convenience, exchange of convenience with the depth of engagement in online counseling? So this was a PhD research topic, and they looked at the process of counseling, the developing and maintaining of the therapeutic relationship with clients online using semi-structured interview with a sample of 9 online therapists. The data was analyzed deeply by means of interpretive phenomenological analysis, or IPA. Now, the evaluation of process factors like empathy, support, working alliance showed that the loss of physical presence affected both the therapeutic relationship and the alliance. So it was generally concluded, and it has been my reading also, that online therapy is most appropriate for less complex clinical problems, because there is definitely a trade-off between depth of interaction and convenience in online therapy. So are we saying that ART patient is simple, has a simple emotional problem? No, the whole infertility is an emotional roller coaster. There is no physical threat, but the stress is higher than HIV and cancer. And you look at the journey, the time span of 4 to 6 years, a couple undertaking this huge journey, facing various cognitive, emotional, social, relational challenges, behavioral challenges, and these change. They are very dynamic. At the beginning, very hopeful, dreaming of a beautiful baby, and in the end, in despair. And not to mention the stages of grief reaction. The grief reaction, which does not end, it does not resolve, and another bad news breaks in. Then it's beyond the scope to mention all the issues like donor, egg, disclosure, and so on, male infertility issues. It is a very complex problem. The net outcome is that 20% of our patients end up with clinically significant psychological disorders. 80% have common treatment-related needs. So can we think that from 3.5, we have increased the level of rate of mental illness to 20%, and this is a complex mental disorder. It is not simple. It is just a thought that maybe the online modality can be useful for common treatment-related needs, and when we have a patient like ma'am just said, that we have a diagnosed case with very high stress and PTSD and severe depression and other disorders, then we definitely need to look at something beyond online. Now, there are the logistic challenges which he has already mentioned. The technology isn't always reliable. The voice may break, the image disappears. And then in a joint extended family, does the couple have a private quiet space with nobody overhearing? And are they really able to find that space and with confidentiality? Now, the most fundamental challenge to online counseling, which has been repeatedly pointed out, is there is a reduced non-verbal cues. So non-verbal cues enter the process of counseling through multiple channels, and all psychologists are very familiar with them. The fact is that 97% of the communication starts at the non-verbal level, only 7% is the words. So in a virtual environment, we have lost all the non-verbal cues, only the face and the eye, which is actually the most vital part of the real natural communication also, the face and the eyes. So the thing is that how does this having a face on screen and having a face in real time, how does it differ? There was a very interesting study which compared these two aspects, which is published very recently in 2023. And it was a multimodal study, not only the subjective but the objective variables were measured, where a pair was compared in person face-to-face interaction, the same pair measured in virtual face interaction. The only difference between the two conditions was that in one, the two people could see each other through a transparent glass. In the other, a TV screen like 16 by 19 inches was placed. The time of exposure was controlled, and there was a measurement which is eye tracking data, pupil diameter, and hyperscanning using EEG as well as FNIRS. And hyperscanning is a very latest technology where two brains simultaneously activated. Their coherence can be analyzed and measured. So this is actually revolutionized the entire field of social cognition. And in this, all the social factors which can influence the arousal, the activation, the interest were controlled because the same pair was going online and offline. The results were very, very interesting. So they found that the pupil diameter is higher in in-person conditions, significantly higher. The average gaze dwell time is again significantly higher in the real natural condition. And both the behavioral measures, dwell time as well as the pupil diameter, are consistent with predicted early behavior increase for in-person face processing. So this is then the EEG and ERP records also showed that although the ERP was exactly identical in online and offline, but the EEG, the bandwidth of EEG, there was increase in theta band in the live condition, which reflects on greater cognitive functions, problem solving and memory consolidation, which starts happening right there and then in the live phase. And then this is the hemodynamic measures where the red parts tell you the significantly more brain activation in real life than in the virtual sphere. So this is the frontal lobe, and that is involved in social cognition. The most interesting is the cross-brain coherence, which was again much more in the live interaction than in the virtual one, where the live phase, the coherence between the two brainwave activities was actually significantly higher. When the same phase came on virtual, the coherence became less. Now, this cross-brain coherence is actually synchronized neural activity. It's like a match going, there's a very rapid cycle of dynamic communication going on between two people. And over time, the coherence is what takes the client out of his malfunctioning modality to the more adaptable way. So this is greater in real phase, and it suggests that exchange of social cues is much greater for in-person than in virtual. And these mechanisms are associated with dorsal stream activity, which is very important in social cognition. Again, the co-regulation and coherence, it's linked with synchronization of non-verbal behavior. That synchrony of emotional processes then transfer to relationships outside the therapy settings. And here co-regulation is more than just matching each other's emotional responses, because it may easily lead to escalating arousal level or co-dysregulation. So instead, co-regulation is maintains emotional arousal and the diet around a healthy homeostatic balance. This is where the stages of empathy that we talk about, the very first perceptual motor process which is happening the moment you look at the client and they look back. There is a mirroring of each other's emotions, so that you get a gut feeling inside of what the other person is feeling, and the patient also recognizes what the therapist is feeling for them, because the mirror neuron is innate and it is functioning in every human being. So at the complex level, at every level, there is an implicit emotional regulation which is based on the direct sensory input which comes from the other person. So in summary, the difference between in-person and online interaction occurs at the visuals, right at the beginning, at the visual sensing level, at the behavioral level, at the EEG level, at the neuroimaging, and at the coherence or the coupling. Now this cross-brain coherence has been talked about by others also, and they have reduced conversational turn-taking behavior and reduced cross-brain coherence compared to in-person interaction in other studies also. And Zoom technology, how does it process the face? The shorter dwell time for virtual condition implies less information was conveyed to the oculomotor system through the eyes, and it is possible that the detection of facial micro movements was reduced with virtual online format. So here the very first breakdown of empathy or communication, and then the dynamic social cues are exchanged by interacting live faces are not similarly acquired or exchanged in virtual online face. Furthermore, typically off-center, when you look at the eye gaze, which is again an important non-verbal cue, in video camera, you don't really get a direct eye cue. The eye contact is a little difficult. Like in face-to-face encounter, you're looking directly into the eyes of the person. However, even if it is a high resolution, just one, I'm winding up. Okay? Even if it is high resolution, the eye-to-eye interaction are compromised or distorted due to camera angle, and the participant looks at the camera. So if they look at the camera, they cannot see the screen, and if they focus on the screen when the webcam is located above, it appears that they are looking below. So the eye contact gets disrupted. So these technological considerations distinguish between in-person and virtual cases may give rise to observed differences in the brain coherence. So in conclusion, we can say that the strength of neural signaling is dramatically reduced in Zoom. Intuitively, we all know that a living human being is much more engaging than a person on Zoom. And increased neural activity among those participating in face-to-face conversation is associated with increased gaze time, increased pupil diameter, increased EEG activity, and enhanced processing ability, more coordinated neural activity. And in this study, we find that social systems of the human brain are more active during live presentation. Zoom appears to be an impoverished social communication system relative to in-person, and the current digital representation of faces do not access the brain's social neural pathways as effectively as live interactions. The human brain has evolved to deal with real human beings in real environment. It is not evolved to deal with the digital human being. Thank you.
Thank you.